Welcome back in, everyone. We are joined by Lisa Sockabasin of Wabanaki Public Health and Wellness. Thank you for joining us this evening.
It's always good to be here, Beth.
So we know that your organization supports folks struggling with substance use disorder in multiple ways. Let's quickly talk about what those things are that you do.
Absolutely, Beth. And as we know, substance use disorder is hitting every corner of our state. There's very few families that don't or not impacted by substance use disorder. So a few things that we're doing. One is medication-assisted withdrawal. That is what was typically or used to be called detox. That is a medication-assisted program where people can, well, safely remove themselves from substances. And that is all medically directed. That is a 24/7 care. That often happens when people are first saying, you know, it's time for me to enter recovery. And it sometimes is that first stop that you make. So we offer medication-assisted withdrawal programming, and that's offered to anybody who needs it, and that's right here in Bangor. We also offer a variety of harm reduction services. Harm reduction services are essentially programs that offer people, well, an opportunity to be safe, even when substance use disorder is impacting them. Those services come in the form of HIV and hepatitis C testing. That comes in the form of safer sex supplies, as well as syringes when they're needed. Harm reduction is also reducing harm in the greater community. So we do a lot of community cleanup, syringe cleanup, and making sure that everyone in the community that is impacted by substance use disorder, which is nearly all of us, have the tools they need and education they need to keep themselves and their loved ones safe.
I think part of the problem too is that people aren't always aware of services that are offered, whether it's the direct supports of services that you listed, and then also that idea of helping to clean up remnants of substance use in the community, which is something that you may not think about right away, but if you're somebody who's walking along and you see sharps on the ground, you may not know what to do.
It can be scary. It can be really scary for people, for families. And so that's why the city has, well, embarked in this partnership with us and many others to, well, report if you need help collecting a syringe that you see on public property. There is a number that you can call, Wabanaki Public Health and Wellness, at 207-299-6378. So that's an important number to remember. Also going on to the Bangor, government website, because there's a, well, report a problem. And in that report a problem area on that website, you can say that you have a syringe that needs to be cleaned up, and we will go and make sure that that's cleaned up. If your syringe is on private property, we will not clean that syringe up on private property, but we will give you all the tools and resources to be able to remove that litter from your private property in a safe way.
All right, that's an important distinction to make.
Very important.
And for those quickly who are actually seeking the support services that you talked about, whether it's the medication assistance or other services, how can they best get in touch with your organization?
Absolutely. So going on our website, WabanakiPHW.org, there are numbers to call if it's a syringe question. There are also 24/7 access numbers to call if you need help. And that's our Wabanaki Care Line, and that can be found right at the top of our website if you go visit us there.
Something folks, again, might not have been aware of, that they can access a human being 24/7.
Absolutely.
Great to know.
We're here for the community and to keep people safe.
All right. Well, Lisa, thank you so much for sharing this important information with us. We really do appreciate it.
We appreciate you. Thank you.
Alrighty, folks. Well, stay with us. Your extended forecast is coming up next.